Motor neurography. The performance of the motor neurography is basically equal for all nerves that are available for this examination. Therefore, it is recommended to firstly analyze the examination by using the median nerve as an example. The techniques shown and described herein are essentially repeated in all other nerves, especially when it comes to the basic application of stimulation and recording electrodes, as well as the method of distance measurement. Motor neurography of median nerve. The instrument adjustments for the motor neurography of the median nerve should be selected as follows. Amplification, 2 mV per division. Time base, 5 milliseconds per division. Stimulus duration, 200 microseconds. The limiting frequencies at NEUROWERK EMG have been stored in the setup settings and cannot be directly changed. Obviously, the device settings should be configured to suit respective diagnostic requirements. The different or active electrode is placed precisely above the muscle venter of the abductor pollicis brevis muscle. The electrode position is determined by abducting the thumb maximally. The indifferent or reference electrode is attached to the front thumb joint. The electrodes can be secured more effectively if the skin is degreased prior to application. The ground electrode is fixed proximally from the recording electrodes. It should be noted that the ground electrode is always moistened and fastened tightly. Firstly, the median nerve is stimulated distally, and this occurs directly behind the wrist. Therefore, the cathode, the so-called minus electrode, is located distally, which means that it is directed toward the target muscle. The distance from the cathode to the active reference electrode stimulation shall amount to exactly 7 centimeters. This enables comparison of the diacritic important value of the distal motor latency with standard values. When using metal pins, it is necessary to apply a little bit of paste to the pins. Felts should be kept moist to reduce contact resistance between the electrode and skin. To avoid large stimulus artifacts, degreasing the skin might also be useful. The stimulation starts with low stimulus intensity and increases slowly, while stimuli are triggered manually as single stimuli. If the stimulation electrode is positioned correctly, a motor potential can be registered with a stimulus intensity starting from approximately 3 mA. It should be noted that the stimulation electrode is pressed firmly on the nerve, otherwise only the superficial skin is stimulated. The stimulation intensity increases through repeated stimulation triggering until the amplitude of the muscle potential stops rising. This results in the so-called supramaximal stimulus intensity being reached. For good measure, the stimulus intensity becomes increased by another 20%. This current intensity should always be achieved, as it is only then that all motor nerve fibers will be stimulated. A further increase in stimulus intensity is not necessary and does not cause a rise in the response amplitude. If the appointed amplifier sensitivity is too large or too small, it is recommended that the sensitivity be adjusted so that the muscle action potential occupies an appropriate place on the monitor. The position of the stimulus cathode should be marked for subsequently defined the nerve conduction velocity. To determine the nerve conduction velocity in the forearm, the stimulation of the median nerve is repeated inside the antecubital fossa, ulnar of the brachial artery. In this way, it is changed into the next measurement sequence on the monitor. In this instance, the nerve is often hard to find as it can roll away under the push of the electrode. The patient can help the examination process by indicating the feeling of the stimulation in the destination area of the median nerve inside the hand. In all probability, the current intensity has to be selected at a higher level in order to achieve supramaximal stimulation. The stimulation electrode should also be positioned across the nerve. Attention should be paid to ensure that the amplitude and shape of the compound action potential is similar to that of distal stimulation, subject to physiological conditions. The marking of the stimulation electrode's position is also necessary. It may be necessary to also stimulate the median nerve proximally inside the medial bicipital groove or in the axilla. For this purpose, either an additional measurement sequence is inserted, or the program should already be pre-configured, or 3 measurement sequences. When measuring in pathological conditions or very strong arms, it may be the case that the maximum current intensity is not sufficient to stimulate the nerve supramaximally. In such instances, it may be necessary to prolong the duration of the stimulation impulse to increase the intensity of the applied current. To precisely determine the distance between the stimulation points, we have marked the position of the cathode of the stimulation electrode with a waterproof pen. Following this, the distance between both points is measured and entered in the results table on the examination monitor. The nerve conduction velocity is automatically calculated by the device from the difference of both latencies and the distance between the 2 electrodes. As an option, the surface temperature of skin can be displayed by using a temperature sensor. It should be noted that the nerve conduction velocity changes depending on temperature. Usually, the device places the marker of latencies and amplitudes exactly by default. However, if due to pathological conditions or standard modifications this is not the case, markers need to be corrected manually to ensure that precise information is provided regarding nerve conduction velocities and amplitudes.